if we do the math, it's a little bit of algebra, but if we do the math in these, school spaces, we can have our teachers and students just going to school like they're supposed to. No problem. That would be normalcy.
Which side are you on? Which side are you on?
So next up, we've got Mike Bailey on the line. He's in the Zoom room, and he is a parent in Madison City who's been pushing for some safety standards in Madison City School. So, Mike, would you care to introduce yourself and talk about what this campaign is and what got you involved in it?
Absolutely. Thank you so much. My name is Mike Bailey, and I'm a malware analyst with an incident investigations company. I work remotely, and I've been homeschooling my child since the beginning of this pandemic. My wife has not returned to the workforce. As you know, the burdens are unequally distributed to women when it comes to these economic impacts. And so here we are experiencing that directly. But we're just parents who are looking to stand up and solve the problem where we've got all these massive ESSER funds that are available and they're not all spent yet. And there are solutions that can directly address the problems of the doubling and tripling of chronic absenteeism in schools, the student illness, the absenteeism that happens from that, the parents getting sick, having to take off work, teacher shortages, substitute teacher shortages, having the National Guard come in and teach your school in New Mexico. Like, we don't need that. We don't need to randomly go virtual because we didn't plan for this. There's actually stuff we can do that I could tell you more about in a subsequent part here.
Yeah, I think one of the things that I wanted to emphasize and why I thought it was important that you come on the show today is because obviously indoor air quality is a labor issue. It's always been a labor issue. It affects people's working conditions and their overall safety on the job. And when it comes to public schools, we're talking about the working conditions of educators and the learning conditions of students. And we know that responses by school districts to COVID has been pretty uneven. It's obviously had impacts on those learning conditions and working conditions. It's also been subject to a very nasty political divisive series of debates. And one of the things that's been really left out of this debate, in my opinion, and underreported in the coverage, is indoor air quality of the schools themselves and how that can actually play a role in COVID transmission and other illnesses, and how we can actually do something about it. So, Mike, could you tell us what are some of the highlights of what you've learned about school indoor air quality and why is that important?
It was really highlighted as a labor issue when there was OSHA testimony for 4 days with the nurses union saying, please implement these things that we know work. And the hospitals themselves were saying, there's no problem here. And the nurses unions were bringing these things up. There's been a lot of fatalism, a lot of, we're going to have to take this lying down. There's nothing we can do. But the solution is actually really clear. The CDC has found that in an actual classroom, HEPA filters at 5 air changes per hour reduce the exposure to particles that would be capable of carrying SARS-CoV-2 into your airways by 65%. In a Hume Foundation study in Italy, they found that 6 air changes per hour with mechanical ventilation got you a factor of 6 reduction in transmission. These are real classrooms, real students, real SARS-CoV-2. And Goethe University in Frankfurt found that HEPA filtration getting 6 air changes per hour had a factor of 6 reduction, also 82.5% reduction in the inhaled dose. And what happened? Here's what happened. In Georgia schools that took action, not even achieving these particular air change rates, but simply if a school implemented both ventilation and HEPA filtration, those schools in Georgia had 48% less incidence of COVID. There is certainly something we can do. There's certainly something we can do.
Wow. I mean, I think that's huge.
I mean, that bears repeating. There was a lot of you said a lot of different things, factors and numbers and multiplications and all this. But the thing to underline, italicize, and emphasize is that the implementation of these air filtration systems decreased COVID cases in Georgia schools that implemented them by 50% approximately?
48%, about half, yeah. And that's not even using the key parameters that we know can increase and maximize this solution. So I believe that if we attend to hitting 6 air changes per hour, as is recommended by the Epidemic Task Force Chair, Bill Banfleth, he's part of the ASHRAE Epidemic Task Force, and he recommends this 6 air changes per hour. If we do the math, it's a little bit of algebra, but if we do the math in these school spaces, we can have our teachers and students just going to school like they're supposed to. No problem. That would be normalcy. Sorry.
That is so huge, because we can argue over masks and vaccines till we're blue in the face, and obviously they're very important in terms of this pandemic. But here's a very tangible example of something that can be done that would significantly improve the material conditions of workers and students alike, and significantly improve community transmission of COVID and other illnesses. And as you alluded to, that helps with attendance, both of staff and students, which in turn helps with academic achievement. It's all connected here. And so I think that's really, really important, the fact that there are measures that can be taken in terms of portable HEPA filters, upgrading the HVAC filtration system, actually having procedures and personnel to monitor this air quality to determine what are we doing and is it enough? Is it hitting the standards? You put that together, and that's something very concrete. And to me, what I like here is that this is common ground that we can find that is for the common good. Regardless of how you feel about how the pandemic has been dealt with politically by either party, we can all agree that we want less kids and students and teachers being sick. And if there's something we can do to make that happen that doesn't get into all this controversy, well, then hell, that seems like low-hanging fruit. I mean, am I summing this up okay, Mike?
Yeah, especially if the funding is there. I mean, the funding is on the table, and schools, like you pointed out, schools are concerned about the learning loss, the disruption that has happened, and rightly so. And so they've been allocating a lot of that funding to address those issues, but those issues are a symptom of the problem. Mm-hmm. What we have an opportunity to do here before this funding expires is address the root cause of the problem. The fact is that water, we know we need to treat. Nobody says you need to just boil your own water. It's a personal choice whether you want to take the risk of drinking water that's got diseases in it, okay? We don't do that with water because we learned. But we're in a place where we're going to have to experience a paradigm shift. Fortunately, there's money on the table. I think you might want to ask me about funds maybe next.
Yeah, right? That's where I was going with this is that not only is this something that can be fixed, there's actually money there to fix it. Could you speak on that for a sec?
Happy to. Okay. I've got a funny way to couch this. Okay. I think we should crowdfund it. Okay. Through a system where parents and everybody in the community would put their money together and, no, I'm just kidding. We already did that. It's called paying our U.S. taxes. We paid our taxes. Okay, we already crowdfunded. Okay, we have mothers in Hoover, Alabama, who are crowdfunding again a second time to be able to put HEPA filters into schools. They shouldn't have to do that. We already did the crowdfunding. It's called our U.S. taxes that we paid. We have these ESSER dollars that are available to schools, and we have a lot of information through Alabama A+ Education Partnership, which is a policy organization that tracks ESSER funding and spending in Alabama. And we have a lot of information about what funds have been spent, what funds are available. The plans that have been made by schools can be changed. And I think they should be changed to directly address these causes, because the cost of these facility improvements and the cost of putting HEPA filtration can be low enough that, I mean, for that price and with the money available, we should take action on this opportunity before the opportunity evaporates. It could cost, depending on the HEPA filter that you use, it may cost as little as for 8-foot ceilings. It could cost as little as 60 cents per square foot to get the HEPA filters into a given space and get 6 air changes per hour. That's assuming 8-foot ceilings.
Yeah, I mean, this is, the thing to take away here is that this is so doable and there's money available. I think the timing is very important here because, as you mentioned, this money will be used or will disappear. So it's an opportunity we have to jump on it. And the other thing I will mention is that in the state of Alabama, every single public school district by September 15th must have their new budget submitted for fiscal year 2023. And by September 15th, they would have already had to have had at least 2 public budget hearings and solicit public feedback and publicly discuss, approve, and vote upon that budget. So we've got time between now and September 15th to do our research and get to work advocating. So
yeah, Mike, when are those public hearings? Do you know?
I actually don't. I'd have to ask my
Yeah,
wife. who's my
typically it's going to
partner
be in
in this.
August. So as school returns in August, you'll start to get notices that the school boards are putting their budget hearings together. And in some school districts, that's really one of your only times you can actually speak at the public school board meeting. They're required to at least give you the opportunity to ask questions and submit written questions for written responses. So, unfortunately, some school districts vary in transparency. So, again, it's an opportunity to dig into it. And I wanted to ask, Mike, how's it going so far, this campaign to improve air quality locally? Like, where do some of the local school districts stand, and what's their reaction been so far?
Sure. So on June 2nd, we had a phone meeting with Mr. John Jones, who is let me actually scroll up in my notes here and make sure I get this right. I don't have his title, but he works in facilities for the schools in Madison City, and spoke also with Michael Gunter and Kevin Guest, the maintenance supervisor. And we forwarded information to them and to Superintendent Nichols on this topic. And we were expecting an answer, hopefully the 24th of June. They reasonably, we had a lot of questions that we also asked them. Reasonably, they asked if we could have answers to that after July 4th. So we asked them this past week whether there were answers and haven't heard back. So we're at that point where we're going to find out if are we working together, or are we going to have to push
Right.
to make this make sense? So that's what's happening in Madison City. In Madison County, the parents we're working with there have been speaking with Mr. Joseph Cuthert, who's the director of operations, and he will have a phone call. Mr. Malone, the superintendent of system services, will have a phone call with a parent who we're working with there. In Limestone County and Huntsville City, we're looking to work with parents who we're actively talking to. You might know some of them.
Right. So we've got some action happening in Madison City, Madison County. Definitely need some volunteers in Limestone County and Huntsville City and some of the other school districts here in our listening area. I think right now it's kind of the research phase. If you're listening to this and you have students in a school, kids, grandkids, nieces, nephews, if you work in a school or you have, loved ones who do work in a school, the first thing would be getting familiar with this research and then researching in terms of what are your local schools already doing on this front, if anything, and how have they been spending these federal funds that have been flowing in since the pandemic. So I wanted to kind of close with, tell us what is coming up next in terms of the campaign, and then how can folks get connected and get more involved?
Yeah, so definitely I'd like to offer to share the resources we've been using to ask questions in various schools. We've actually been working with parents in Connecticut, Maryland, Michigan, San Antonio, Austin, et cetera, to give them information about what we're doing here and share what questions we're asking, because before you try to tell somebody what they need to be doing, you need to find out maybe what are they doing.
Right.
So we have a list of questions that we think are to the point and that have to do with what we're asking. We have a great body of information that we've gathered about the recommendations that the CDC has put out there, and a great body of information about research that bears that out and says, yeah, we really ought to be doing that. So I would invite anybody who wants to make a difference in this, both locally and anybody outside of our area, to visit our Facebook page. It's Indoor Air Care Advocates. And if you go to facebook.com/Indoor Air Care Advocates, all one word, that'll get you there. Also on Twitter, we are IAQ Advocates. That stands for Indoor Air Quality. And you could email us at indooraircareadvocates@gmail.com. We were planning on having a meeting next week, and that is postponed. So stay tuned for more information on our Facebook and our Twitter, and definitely email and get in touch with us, and we'll share those materials with you.
Awesome. Yeah, this is a great campaign and really super common sense. We've got the money. This is something that, we should be, it would be good even if there weren't a pandemic, because nobody likes to get sick anyway. I remember growing up, every now and then, every few years, we would have school closing because the flu was going around and so many people were out of school. And I think everybody really does want to minimize school closures. And when we're talking about decreasing COVID cases in schools by 50%, you're going to decrease the necessity for closing schools because of COVID. So this is a super common sense thing. Really good stuff. Follow those links that Mike gave you, everybody, if you've got a stake in this. And Mike, we appreciate your time.
Thank you so much.
Thank you.
Yep. You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.